summer in July, I was walking to work one morning, and I felt I wouldn't really describe it as a pain, more as a sort of slight discomfort in my chest. So I just ignored it and hoped that it would go away. But it didn't, and over the next few weeks it got worse, and whenever I was walking or swimming I was finding that the pain was going into my shoulders. So I thought I'd better go and see my GP, and I did, and she said that what you just described to me sounds like angina. And I just thought, well, it can't be, because I just didn't have any of the risk factors. Never smoked, wasn't overweight, didn't have a family history, was actually reasonably active, swim twice a week and walk. But anyway, there obviously was a problem. So my GP sent me for an ECG, which confirmed there was a problem. I hoped it would be a chest infection, or that I pulled a muscle, or it was the sort of old thing about pain in the chest, but it's quite often in indigestion when people think that they're having a heart attack. So I tried to think of anything it could possibly be other than angina, and there are, that sort of pain isn't always angina. It could very well be a chest infection or a pulled muscle, but in my case it wasn't. Well, the next step is to I went for what they called an angiogram, again at Preston Hospital. It's a very simple procedure where they sort of put some dye in through the artery. They go in through your groin, pump dye into the artery. That goes all the way up into the arteries surrounding your heart. And from that, the doctor can actually see he can actually pinpoint the problem, which artery, which part of the artery. And then, of course, that absolutely confirms that it's angina that's causing your symptoms. I understand it's partly due to the ageing process. As we get older, bits of sort of fat sort of stick to the side of the arteries. And everybody, once they get to a certain age, will have that to a certain extent. But in my case, for example, like part of one of the arteries had got so blocked up that I think it was something like 99%, so the way through it was just like a pencil line. I think all people who've had a similar heart attack or angina, any sort of treatment for a heart problem, are offered a 6-week rehabilitation programme, and I would strongly advise anyone who's offered it to go on it. It's a mixture of exercise sessions at a gym, and there's also, I went to a set of 4 talks which covered improving your diet, exercising, managing stress and managing your medication. And they're an absolute wealth of information, really. For example, the exercise one emphasises the importance of building up gradually so that you don't fall into the, I suppose it's tempting to sort of think, oh God, I must exercise, so you sort of go out and go mad. The rehabilitation nurses were very, very supportive. They were always there to answer questions. And because you're seeing them twice a week, you're not forgetting the things that you want to ask them. And they were always there with encouragement. The benefit of doing the exercise programme along with other people who are in the same position is really, I think a lot of people get put off in a gym because you're sort of like in there with people who are really fit athletes. Whereas if you go on the rehab programme, you can get used to using the gym and the equipment with people in the same position as you, really. And again, we're all sort of building up gradually. Well, my life has changed hugely, really. I suppose, first and foremost, I am much more careful about my diet. Before this happened, I was I'm not sure that I had a particularly bad diet, but I was a bit careless about it. And for example, if I didn't have any fresh fruit and vegetables in, I would just do without rather than go shopping. Whereas now I make a big point of making sure that I get plenty of fresh fruit and vegetables, and I read all the labels, and I make sure I'm not eating anything that's too high in fat. There's loads of opportunities in a day actually once you start thinking about it, where you can actually, it's important just to move even if it's for a short time. So I always walk upstairs rather than getting a lift. And I was waiting for a train the other day and had quite a walk, and instead of sitting in the waiting room, I actually went for a little walk round, even if it's up and down the platform. It's just to sort of like move about in the course of a day. Firstly, to make sure that you're having a balanced diet with plenty of fresh fruit and vegetables. Secondly, that you're getting plenty of exercise and moving about and just not having the sort of life where you're just sitting watching television all the time. And thirdly, just trying to keep things in perspective really, because stress is a factor in these things. And it's important to make sure that you get enough time off.